lesson 3, we will talk about potency, efficacy, and therapeutic index. To determine potency and efficacy of a drug, usually we use dose response curves. The dose response curves can be two types. First one is called graded dose response curve. Second one is quantile dose response curve. The main difference between the two response curves are in the y-axis. In case of graded dose response curve, the y-axis is the percent maximal effect and the x-axis is the dose. The dose can be presented in a linear scale or it can be presented in logarithmic scale. If we present the graph in a logarithmic scale, the graph looks like a sigmoid shape. So these graded dose response curves are good to determine or compare the potency, relative potency and relative efficacies between two or more than two drugs. So first of all, what is potency? Potency is a measure of the amount of drug necessary to produce an effect of a given magnitude. So in this example, drug X and drug Y, both of them have produced the same magnitude effect, but drug X required less amount of the dose compared to drug Y. So that's why drug X is considered more potent than drug Y. So it means that less dose is required. So lesser dose means more potent. So in case of efficacy, again we can use the similar type of drug X and Y example, where you can see that drug X produce very high effect but drug Y produce lesser effect. So in this case, drug X is more efficacious compared to drug Y. It can happen, for example, in the earlier lesson 2 we showed that agonist and partial agonist. Agonist is producing the maximum effect, partial agonist is producing the lesser effect. So here drug X could be an agonist, drug Y could be a partial agonist. Now let's talk about quantile dose response curves. In case of quantile dose response curves, the y-axis have percent patient responding and the x-axis have the dose. In case of quantile dose response curves, usually we have two types of graphs for the same drug. The first graph usually is for the therapeutic effect. The second graph is usually for the toxic effect. And both of these graphs can be utilized to determine the therapeutic index. So from the first graph, we can determine at what dose 50% of the population responded. So that one we can say this is effective dose 50 or ED 50. And from the toxic graph, we can determine when the 50% of the population died. So from that we can calculate lethal dose 50 or LD 50. And the ratio of this LD 50 and ED 50 is called therapeutic index. So TI or therapeutic index equals to LD 50 divided by ED 50. You can remember this equation if you remember TILE, T-I-L-E. And so if this ratio is bigger, it means the drug is more safer. So therapeutic index is a measure of drugs safety, and the larger value means the drugs are more safer. So for example, there are some drugs like warfarin and digoxin, so their therapeutic index is very small, so we call them narrow therapeutic index drugs. So in those drugs, if we make any mistake in the dosing, it will have very serious consequence. But there are some drugs like penicillin or acetaminophen where in those drugs the therapeutic index is very large. So therapeutic index is very good indicator to compare the safety of different drugs.